I'm really honored to stand in front of you here today and share my experience of having to live and deal with myeloma for the last 20 years. But most of all, it really is my responsibility to stand in front of you here today and share my experience of having to live and deal with myeloma and respect those that have gone before us. Because without them, without the sacrifices that they paid on our behalf, and the digital and physical footprint that they left behind for us, you and I will not be experiencing the quality of life that we are experiencing today. And we wouldn't have seen the rapid advancement in multiple myeloma treatment that we have seen over the last several years. In the next 30 minutes, I will share my experience of, as I mentioned, having to live and deal with myeloma, but I think more importantly, balancing the myeloma equation of life and death, and how to incorporate myeloma into your life and live with, not for myeloma. And I'll share my experiences and the resources that have enabled me to be able to do that over the last 20 years. Less than 2% of myeloma patients are younger than 20 years when they were diagnosed, or when they are diagnosed. I was 25. It was 3 years before my 26th birthday. And I was severely anemic. I had lesion head to toe, and my plasma involvement in my bone marrow was over 70%. So as a friend of mine said, I was a really, really sick puppy in 1995. With the average myeloma patient being at diagnosis at late 60s, early 70s, I was not alive in the 60s to undertake the gypsy lifestyle that most of you were part of. And so I can't blame my myeloma on the things that I smoked or did or whatever it is that you guys did at that time, right? But being diagnosed at that early age, that young, has both a disadvantage and an advantage. The disadvantage is obvious. I was newly married, going to graduate school, and anticipating a full life ahead of me at 25. The course of our family life changed when I was diagnosed with myeloma. Instead of children, we have dogs now. But they act like children. But being diagnosed at that early age has also an advantage, right? It means I can withstand harsher treatments than most other people do. And I didn't have as much a comorbidity because of my age as you would normally get when you are in your late 60s or early 70s. I also had two other advantages. One is how the doctor told me I had myeloma, and the other one is the response I had when I found out I had myeloma. The doctor basically called me at the place that I was interning and said, hey, Yelak, I got the result of your test, your blood test. You have multiple myeloma. It is not curable. It's highly treatable. Come to my office and we'll talk more. And what I heard was blah, 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 and more blahs, right? And I didn't care that I had myeloma, or I didn't know it was cancer. And when I found out it was cancer, I kind of didn't care, because he already prepared me by telling me that it was highly treatable. So he kind of helped me set my mindset in terms of what kind of response I was going to have for when I found out it was cancer. The other thing is also, soon I found out that multiple myeloma affects African Americans at a higher rate than Caucasians. And when I found out that it was me who had cancer and not my dad or somebody else in my family, I kind of was happy. Because if anybody can fight myeloma, I figured I could. When you find out you have myeloma, you are scared, and you are praying the serenity prayer for God or whoever to give you the wisdom. But if you are on DEX, your response may be a little different. You are wanting to make sure that you are nice to people that piss you off, right? But if you are on a higher level of decks, you are asking for wisdom to make sure their bodies are undiscoverable. And it could be the patients that could be doing the killing, or it could be the caregivers that could be doing the killing. I didn't know this until recently. You could actually find decks in gluten-free form if you need that. I found that recently. So I'm going to spend a good amount of time on talking about the response mindset once you know that you have multiple myeloma or somebody in your family has multiple myeloma. You should really understand things that are outside of your control and kind of come into terms with them fairly quickly. It's my belief that you shouldn't dwell on things that are not within your control, that you cannot influence or you cannot change. Know what they are, understand they exist, acknowledge their existence, and move on to things you can control, change, and influence. You, for example, don't have a control over why you are diagnosed with myeloma, why you are diagnosed with myeloma at your age, or why the person who's sitting next to you can withstand harsher treatments than you, and they don't kind of have any side effects. But when you are on a lower dose treatment, why your side effect is much higher than theirs, right? So those are things that are outside of your control. But you have 100% control over how you decide to respond when you know that you have myeloma. You have 100% control over what kind of relationships you are going to form through the course of your myeloma. And you have 100% control over how you are going to educate yourself in order to do those two things well. It doesn't mean you like having myeloma. It just means that you are willing to adjust and adapt. It just means that you are willing to fight the battles that are right for you. How many of you know Mike Katz, who Mike Katz is? Yeah. Mike was diagnosed with myeloma in the early 90s. When he was diagnosed, day one, he knew he was going to die of myeloma. But before he did, he had life to live. He had children to raise. He had grandchildren to spoil. And then he had operas to attend wherever in the world that he attended. During the 25 years he lived with myeloma, since he was diagnosed in 1990, he became an advocate of advocates. Everyone in the cancer research advocacy field knew who Mike Katz was. He challenged traditional thinking. He always pushed the boundaries for better quality of life for myeloma patients in particular, and cancer patients in general. Through the years, Mike has given countless presentations, and he has taught us countless things. But his number one teaching, in my opinion, he lived by example, was this.
It's not normal to be totally relaxed about having myeloma. If you can keep your calm amidst all of this, you obviously don't understand the situation. Everyone has to die someday, but if you just let yourself be consumed by the prospect that someday you're going to die, you're wasting your life. And it's really important to just kind of try and put this in the back of your mind and live your life and enjoy life, and don't let this ruin your life. Now, there's a great Mae West quote that I like to use in this context, because being too good can really get you killed. If you try to be nice to people, there's no return in the medical system. Mae West used to say, when I'm good, I'm very good, but when I'm bad, I'm better. And I think that very much applies to myeloma patients. So, we're all in this for the long term. Our objective is to be Betty White, I think, in the long term. And let's ditch the doom and gloom and live the rest of our lives. Just have a good time while you're doing it.
So I think Mike was secretly in love with Mae West because there was no presentation that he didn't talk about Mae. And Mike also has a really great point. We are all going to die. And I had the good fortune of being able to have a lunch with Professor Hines a couple of weeks ago. And he said, cure for myeloma means that patients are dying at the same rate as the general population. He said, what? I said, what? You mean I could be cured of myeloma and still die? He smiled the same way he was smiling and said, yeah. So when you know that your goal is not to live forever, a big burden gets lifted off of you. And your goal shifts from maximizing the quality of life you have while you are here on Earth and living with myeloma, right? So it's really all about perspective. Maybe 10, 15 days ago, I had an ex-member of our support group call me, and we're talking over the phone. I was in the living room. My wife was in the bedroom. And the discussion I had with this person was that they were having difficulty moving on after they lost their spouse. And so we went back and forth and discussed several things. And when we hung up the phone, I said, hey, Lula, that's the name of my wife. I told her, when I die, mourn, be sad for 6-9 months, and get a dog, I told her. Get over me. And she shouted back from the bedroom without even coming out from there. She said, you know, there's no guarantee that you are going to go before me. I could go before you, she said. And then if I die before you, she said, get a dog as soon as you can, she said. But when you die, she said, I'm getting me a man, she said. So it really is about perspective, right? So that gives me the right perspective to make sure that I lived as long as possible. So it really becomes changing the fear you have at diagnosis or at relapse or at third or fourth relapse, as I had 4 relapses in the last 20 years. Changing that to hope becomes your goal, and maximizing the quality of life you have while living with multiple myeloma.
Going out tonight, I'm feeling alright. Gonna let it all hang out. Gonna raise the noise, really raise the voice. Yeah, we can shout. No. Morning, Sheldon, come dance with me.
No. So you choose what your response is when you are diagnosed with myeloma, right? So me and my wife, this some examples of how we have lived our lives since I knew I had multiple myeloma. We have been able to travel the world. We have looked at the tallest building in Dubai and the tallest library in Shanghai, one of the oldest churches in Africa. And we have also done, or I have also done, some stupid things. This is me feeding wild hyenas by mouth in the wilds of Africa. A friend of mine, Jim O'Mell, said, that's the dumbest thing to do. You could survive myeloma and be killed in the wilds of Africa, right? But during these 20 years, I have also been able to raise my niece and nephew and see them graduate from college and become gainfully employed. Those on the left-hand side are my parents. They just Valentine's Day celebrated their 56th wedding anniversary. And my mom celebrated on that same day her 70-plus birthday. She doesn't say 71 or 79, 70 plus, you know. So myeloma is a team sport. It's not meant to be played by yourself. When I say you, it could be your caregiver, it could be your spouse, it could be a family member, or it could be somebody that you know who's playing the caregiver role. Because when you are on steroids, and when you are going through harsh myeloma treatments, your caregiver could be your link between sanity and you, really. So you really need to have a caregiver. But you also get a local oncologist. Mostly you get a local oncologist by circumstances. In that, I mean, I got my myeloma oncologist when my internist told me there is a hematologist across the hall, go there. So that's how I got my hematologist. But we formed a good relationship. I stayed with him for 19 years. But you need to find, and not only find, build a relationship with a myeloma specialist. Somebody here earlier mentioned that you need a myeloma specialist, right? But don't make that myeloma specialist a consultant only. You need to have a relationship with him or her in order to make sure that he and she understands what your quality of life objective is, what your life expectancies are, or what your other non-myeloma commitments are. You also need, because you are planning to live long with myeloma, you need to have an internist. Whether you have a cardiologist or some other doctor is also important, because now it becomes not only treating your myeloma, but treating your whole self, right? So you need to make sure that you have a really 360-degree perspective of your health. Don't forget nurses. Nurses are really good, and in my opinion, better than some doctors in managing your side effects, as you will hear in a few minutes. So make sure that your nurse is part of your journey as well. And if you need any other specialties, make sure that you are able to get those other specialties as well. And this is why you need a myeloma specialist, in my opinion. The variables of myeloma at diagnosis, your prognosis, your treatment during your relapse, and through the life of your myeloma as you start to live longer and longer with myeloma becomes very complex. You need somebody who is always treating myeloma patients. He's researching myeloma patients or the myeloma disease, and is always living and breathing myeloma. Don't be fooled that with somebody who's treating a handful of patients, myeloma patients a year, is a myeloma expert. Because even within two myeloma experts, their approach to how they treat you is different, right? When you saw earlier Dr. Duri and the other doctor talking with each other, their approach to treatment in some cases is going to be very different. And when you see Dr. Osmani tomorrow, his approach and Dr. Duri's approach are going to be different on how they treat you, how they treat your multiple myeloma. Neither is wrong, but you need to choose one and make sure that you form relationships with them. But then your question is, how do you choose which myeloma specialist that you are going to associate with and build relationships with? I'm glad you asked it. The first question I have is, are they a member of the IMWG or some other reputable organization like that? But I think being a member of IMWG for me, for my specialist, is a prerequisite, because when they are a member of IMWG, they are being accountable to their peers. And their peers are recognizing that they are a myeloma expert and inviting them to join them as part of the IMWG. Sure. The IMWG stands for the International Myeloma Working Group. It is a research arm of the International Myeloma Organization and has about 200 world-renowned myeloma experts from around the globe. So if you are living in the US, there's no reason why you cannot have a myeloma specialist that's a member of the IMWG, in my personal opinion. But with that membership, you also need to understand what your doctor's personal biases are and their hospital affiliations is. Somebody who's affiliated with Cedars-Sinai versus Arkansas versus Mayo versus Dana-Farber, their approach is going to be different, because not only are they bringing their biases, they are also bringing the biases of the organization that they work for. Also, within those organizations, you really need to find somebody who has enough influence to be able to and wanting to customize treatment for you. As you have heard earlier, kind of maybe 75% of the responses that the experts were giving was, well, it depends on your case. Well, it depends on your case. So if it depends on your case, I don't want to get what is normal at that hospital. I want to get what should be normal for Yelak, right? So I want to make sure that I have somebody, I'm associated with somebody who has ability to influence and the clout really within their organization to influence and customize treatment for me. They may be good, but they also, in my opinion, need to have a good bedside manner in order to be my doctor. Meaning, if they're really, really good, surgeons could be good and get away having a bad bedside manner because you are almost always under when they are operating on you, right? But myeloma patients, they are interacting with you on an ongoing basis, and you really need to make sure that they have a really good bedside manner. But most of all, find somebody who has a heart of a teacher, because during this process, you need to be educated. During this process, the myeloma expert should be willing to work with your local myeloma oncologist or with your local hematologist in order to customize treatments for you. So find somebody who's a teacher at heart. I'll give you an myeloma expert. I had a wart on my right hand that wouldn't go away for almost a year. The dermatologist, froze it, they burned it, they cut it, and they did everything they could. They couldn't get rid of it. Finally, I went to the department chair at UT Southwestern, and he said, I'm going to inject something in your hand, and I think that will take care of it. But he said, it is going to have these side effects, but I want you to read and understand those side effects, and I want you to make that decision that you want to go forward with this. He actually gave me a book. He stepped away for 20 minutes, and he came back, and he said, do you have any questions? And so that is the type of heart of a teacher that you want on your myeloma team, because myeloma is much deadlier, in my opinion, than warts, and I think it deserves a myeloma expert that is willing to work with your local oncologist, teach you, and in the way, teach your local oncologist to be as good. So it's clear, for anyone to be your doctor, for anyone to be my doctor, the bar is high, right? Because you have choice. You are, at least for those of you who are living in the US and not coming here during the winter from outside of the US, you have the opportunity to choose your myeloma specialists. You have the opportunity to choose your local oncologists. So initially, you need to find the right doctor, but you need to also assess throughout your relationship with your doctor, is it time to find another doctor? Because the situation of your doctor may change as well, right? Because the doctor is also a human being, or she is a human being, and she may have a new boss she doesn't like, and she's always pissed off. So you really want somebody, so this is true in any profession, right? Or your doctor, he or she may be doing really well, and now she's promoted to a higher, bigger responsibility, and she doesn't have time for you any longer. So you really need to continually assess, is it time for...
You know what, buddy? Guess what? You're fired. Simple as that. It's the last time I'm made to look like a fool.
Is it time for another doctor? So there are many reasons, in my opinion, you need to change a doctor, or you should consider changing a doctor. Your doctor needs to be able and willing to listen to you. When it comes to treatment, you really need to have a veto power in terms of what and how you are going to be treated. If a doctor tells you, if you don't do X, Y, Z, I'm not going to treat you, you need to even not respond. In my opinion, you need to go find another doctor who is willing to have that conversation and make this a joint decision between you and the doctor. Changing doctors could be traumatic. I had to go, once I decided to change a doctor, through really interview processes. It's kind of, finding a new doctor is kind of dating, right? You need to find the right person, the right cadence with that doctor, and be able to form a long-term relationship with your doctor. But do not also change oncologists because you are miserable. In general, a miserable person, or you are early in your life and you are going through the learning process, or you are having treatment side effects, because all treatments today, even with approval of those 3 drugs last year, is going to require some level of discomfort, some level of misery, if you like. So don't change a doctor just because you are not happy that you have myeloma. I actually like the quote over here. My doctor told me to exercise. It gave me more energy, and I got more work done. The more work I did, the more mistakes I made. Then I got fired. That's why I'm suing my doctor, right? So again, it goes back to having some level of perspective. So did you guys know that the IMF was formed under this motto of 1% can make a difference, 2 can make a miracle? And there are close to 300 people here. You guys can make waves. So you need to educate yourself, but you individually does not know as much as we know collectively. If you haven't called the IMF info line, you really need to consider calling them. Because the picture you see on the left-hand side is a picture of the office that I took. It's not, they don't have motivational quotes over there. You know what they have? They have pictures of patients that they have interacted with over the years at their defining moment in life. When somebody is having a baby or a grandbaby, or they're walking their daughter on the aisle during their weddings, that's really what's motivating them. They don't look at you as myeloma cells. They really look at you as a member of a family, a husband, a wife, a mother, a grandfather, and anything in between. So when you call them, that's the kind of person you will get on the call. So call them. If you are not a member of the Smart Patient, which is an online support group that my cats formed in the early 90s and evolved into the current Smart Patient, you really need to be a member of that. I hear the person who's helping moderate that is a really good, smart person. I moderate that, by the way. There are hundreds of support groups throughout the US, and in Florida, there are a bunch of them. So if you are not a member of a support group, and not just a member, an active member of a support group, you really should consider becoming an active member of a support group. And you guys are attending patient and family seminar, but if there's somebody who's not here, you really want to invite them to come next time. Or if you have somebody who's in Denver or somewhere else, as somebody else mentioned earlier, you want to make sure that they are able to attend that meeting.
Just tell me what Leonard does.
All right. Leonard is attempting to learn why subatomic particles move the way they do.
Really? That's it? Well, that doesn't sound so complicated.
It's not. That's why Leonard does it.
Okay, I just have one question. What exactly are subatomic particles?
A good question.
Thank you.
And to answer it, we first must ask ourselves, what is physics?
Oh, balls.
So if you can't tell, I am a fan of the Big Bang Theory. When you educate yourself, you kind of can, over time, get overwhelmed. So you really need to make sure that you are not going to have an information overload and give up in general, right? You need to categorize information that you consume, information you pass to somebody else, and information you file away. Because you individually is not going to be able to synthesize each and every information that comes on an everyday, on an ongoing basis. So choose what information, based on your history of myeloma and what your quality of life goals are, that you are going to synthesize. But most of all, find a mentor. For me, Peter Tischler, the founder of our support group, was one of my mentors. And over time, it evolved to being my cats. And I also have other mentors like Jack and Jim that are really very active in the myeloma community. So find somebody who's going to and willing and able to not only walk you, but also tell you, don't forget to flap like your life depended on it, and push you out of your nest, right? Questions to ask before your treatment begins, right? What are your personal goals of treatment? The doctor has a goal, you need to know what your goals are. For me, quality of life is really a big goal for myeloma. And for me, how I define quality of life is time. Time I get to actually live life. Time I get to be able to give back. And time I get to actually work and make sure that we have a roof over our head, right? So your quality of life may be different. You want to spend more time with your grandchildren, or you may want to continue to travel, or whatever it is. But decide what it is and communicate with your doctor, as it was said earlier. I also had the opportunity to be able to listen to Dr. Robert Kyle, who is the father of myeloma, who wrote his first paper on myeloma in 1960 before I was born. And here's what he said. Over the last 15 years, there were much more and much deeper advances in multiple myeloma than the 40 previous years combined, right? So it is a very hopeful era to be a myeloma patient if one has to be. And I strongly believe that we are at the cusp of what is called an industrial revolution for myeloma. And you will hear about that throughout the conference, the Black Swan Research Initiative, and many other things that DIAMF, in collaboration with other doctors, is bringing to the table for you. So one of my other goals for treatment is to make sure that I don't close the door, knowingly or unknowingly, to what could be around the corner, right? So you need to have that open dialogue with your doctor. And this is not as simple as it sounds, and it's very complex on how to ensure that you have current quality of life and you are staying alive to be able to go to the next one, to the next treatment. So this is a lot of information. Some of it hard, some of it kind of absorbable. And you may be questioning, do I have it in me to be able to do this?
Lost touch with my soul. I had nowhere to turn. I had nowhere to go. Lost sight of my dream. Thought it would be the end of me. I thought I'd never find my way. I thought I'd never live that way. I thought I might break. Didn't know my own strength. I crashed down, stumbled, but I did not crumble. I got through all the pain. Didn't know my own strength. Survived my darkest hour. My faith kept me alive. I picked myself back up, hold my head up high. I was not built to parade. Didn't know my own strength. Oh. Found hope in my heart.
Thank you.